Here we go, let's see now. There we go. So arthritis, it causes debilitating pain and there's a decreased quality of life. And so many of us know that from firsthand experience. And we can help our clients by helping them regain some independence and finding pleasure in the activities that they do, okay? True or false? Arthritis is minor aches and pains associated with getting older.
No.
False. It is false. So, arthritis is like dementia. It's an umbrella term for a complex family of diseases that affect the musculoskeletal system. And it affects all ages, all races, and all genders. And in reality, 2/3 of people with arthritis are under the age of 65. Okay, so. Yeah, arthritis is a serious health problem, true or false? True. So the statistics say that it's the leading cause of disability in the United States. It says here that 44 million visits, outpatient visits, are associated with a diagnosis symptom, and that 100,000 hospitalizations a year are associated with arthritis symptom, and need. So that's pretty significant. And then true or false, people with arthritis should avoid exercise.
No.
Oh, you guys know it all, I don't have to do this. Exercise is the panacea for everything, right? I mean, if you come to the Parkinson's workshops, if you come to the dementia workshops, exercise is so important. It prevents some of the natural side effects of aging. It helps with strength, it helps with flexibility, it helps with stamina and balance, right? So exercise is really, really important. It's a challenge when you have arthritis because it hurts, but it's still, we need to encourage our clients to do their physical therapy. And then the other thing, citrus fruits can cause inflammation.
Repeat that. I didn't hear it.
Citrus fruits can cause inflammation.
False.
It's false, okay? Vitamin C can protect against osteoarthritis, it can help with pain, it helps to form collagen, which is a major component of cartilage, which is what is affected with the arthritis. So there is a dietary component, which we'll talk about later, that is useful. There are some things that we should stay away from that cause inflammation, but there are some things that support the healthy diet. Okay, so at the end of the class, we'll be able to list 3 different types of arthritis and symptoms, and obviously what you can do to support your clients. And you guys already know this. That part is really just a review for you. But the disease process itself, as I said, arthritis is an umbrella term, and it says 100 conditions that are considered arthritic conditions, and roughly 50 million people in the United States are affected by one of these. Okay, and we're not even going to go over the whole 100, but just know that it impacts mobility, and it impacts the person's ability to do their daily activities. The 2 most common forms, okay, are osteoarthritis and rheumatoid arthritis. And I'm talking to the crowd here, everyone knows what I'm talking about. But osteoarthritis, it's the most common. Approximately 27 million Americans have osteoarthritis. Okay, it was felt to be like the disease of usage, right? Like we get older, we use our body, we develop osteoarthritis. But research is finding that there is a chemical imbalance and chemical changes in an inflammatory process that causes it. So it's not just that we're older and we're using our joints for 67, 70, 90 years. There is a chemical and inflammatory process going there. The symptoms of osteoarthritis, they include pain and stiffness in the affected joints, particularly in periods and even after rest, okay, or in periods with exercise. So it can happen at any time. It's not just that you've been walking a lot and all of a sudden you hurt. And the pain and stiffness can increase and interfere with sleep, and there's a rubbing together of the bone. So there's a loss of the synovial fluid, and there's a rubbing together of the bone, which can cause a crackling sound. Okay. Did I? So, pain and stiffness in the joints. Joints feel like they're rubbing together. They can make a crackling sound. And the other thing about osteoarthritis is that it's only one joint that's affected. So it might just be your left shoulder. It might just be your right hip that's bothering you. It's not something where you're going to see a bilateral engagement. Okay, it's just one particular joint that's going to be affected. So it's inflammatory. Now, rheumatoid arthritis is more of an autoimmune response. It's your immune system that's attacking the membrane and the lining of the joints. And with rheumatoid arthritis, there's pain, there's swelling, there's stiffness, there's deformity of the joints. So we've seen people with rheumatoid arthritis, their fingers start to curl in, their toes curl, and you may see deformity in some of the other joints. And that's from the rheumatoid arthritis. There may be fatigue, a low-grade fever from the inflammatory process, and obviously a loss of appetite. The thing about rheumatoid arthritis, they can also develop lumps under their skin at the synovial processes and joints. And this particular arthritis is symmetrical. So if it's going to be in your right hand, you're going to have it in your left hand also. You know, if you're going to have it in one foot, you're going to have it in both feet. Now, these are some of the other 100 forms of arthritis. And some of these things we don't think about as an arthritic condition, but they really are. So fibromyalgia, it's a condition characterized by muscle pain, joint tenderness, and it's applied to specific joints only. And 1 in 50 Americans have fibromyalgia. There was a time, it seems that it's often more common in women, and there was a time when people thought that it was like a psychosomatic type of a thing, and they weren't taking it seriously. But it is an inflammatory process. It is an arthritic process.
Isn't that an autoimmune thing too, Julian?
A lot of these are autoimmune,
Okay.
okay? A lot of the rheumatological problems that we have are autoimmune. It's our own body fighting us. And, you know, we're not sure why all of it happens. So gout, you all are familiar with gout, but it's considered an arthritis. It's when there's a buildup of, uric acid. Yeah, thank you. It's a buildup of uric acid. It tends to be in the big toe, but it can spread. You know, untreated, and over time it can spread, and it's very, very painful. And it's because these crystals are forming, these uric acid crystals are forming. I always wonder too, because sometimes that happens with kidney stones too. It's the uric acid that crystallizes in the body if we're not flushing it out enough. And sometimes people end up with amputations because of it. Okay, osteoporosis, it's the most common type of arthritis, and it's related to it's a decrease in thinning of the bones and the marrow, and our bones become more brittle and we become prone to fractures. As a group of women, we have, after menopause, osteoporosis is something that happens more frequently. I know I get bone scans periodically every couple of years to monitor my bone density. I'm on calcium because of it, and for another reason too, which I'll explain later. But so osteoporosis is common, and it's very common in women, okay? And the thing about it is that sometimes the fractures don't show up on x-ray. So, and the thing about pain associated with some of this stuff is that you may have a client who is in a lot of pain, and they may have osteoporosis, and they may have fractures that may not show up, the fracture may not show up, or the fracture may show up on x-ray, but they may not be in any pain. But over time with osteoporosis, it's affecting the spinal column, and there's fractures of the spinal column, and that's when you start to see like a kyphosis, like that hunchback look of some people that you see that are walking around, and a lot of it's related to the multiple spinal fractures that they've been having. There's also weight loss, rounded shoulders that you can see. So I mean, an example of a fracture, my mother-in-law, she slipped and hit her bottom on the bathtub months ago, okay? And she's in for some other reasons, and she ended up having an x-ray. And for 2 or 3 months it didn't bother her, but it was bothering her now, and the x-ray showed a hairline fracture in her coccyx, but she didn't even know she had done it. And so sometimes with these fractures, if you're not feeling the pain and they're not healing properly or in alignment, it can cause that, that off balance or that rounding of the spine. Okay. Alkalizing spondylosis is a whole big one. So it affects the spine. It's an inflammatory process, and it affects the vertebrae and the joints of the spine and the pelvis. And that causes a lot of back pain and stiffness. Another one is lupus, and we all have heard of lupus, often we're familiar with it. And lupus is an autoimmune disease specifically. And it is an immunological problem. There's inflammation of the tissue and damage because of that inflammation of the tissue, and it affects the joints, the skin, but lupus can also affect the kidneys, the lungs, the heart, the blood vessels. It can affect the brain. Okay. Polymyalgia rheumatica. Now this is something that I have. So I was talking about autoimmune disease. It's also considered sort of an autoimmune disease, and it's muscle stiffness and shoulder and hip stiffness. And I developed it after a trip to India, and I don't know what happened, but I used to teach yoga and meditation. I've been a nurse, I've been active, and I had never had any problems with movement, but I ended up with getting bursitis, what I thought was bursitis in my hips. They were diagnosing it. And over time, my SID rate, which is an inflammatory marker, was not rising. And so over time, they didn't know what the problem was, and it kept getting worse and worse and worse. And then finally, actually, my husband diagnosed me. He went with me and said to the rheumatologist, "Abby, do you think it could be polymyalgia rheumatica?" And she said, "Yeah, maybe." And they put me on steroids, which is one of the drugs that treats a lot of these symptoms. And within 72 hours, I was pain-free. I had been 9 months in pain, and within 72 hours, I was pain-free.
Oh, my.
Which is, so, I mean, I had gone to homeopaths, I had done everything that I could to try and figure out what was going on. And then at that point, finally, my SID rate was up high enough that they said, okay, this is a confirmation that this is what you have. It's been 10 years and I'm still on a very low dose of prednisone. But the thing, we're going to talk about the medications. Steroids are used commonly to treat these arthritic conditions, but they have their whole group of side effects in and of themselves. So I've been very lucky. I haven't had a lot of the side effects, but I have some of them. Let's see. Polymytosis is another chronic inflammatory disease that affects the skeletal muscles, particularly the muscles that are close to the trunk. So it's more like around the neck and the shoulders and the pelvis and the hips. And Sjogren's syndrome is also a condition, is a immune system. The immune system damages your moisture-producing glands. So what happens is that your eyes feel dry and gritty, or your mouth gets dry. You don't have the saliva that you need. And again, and your tear ducts aren't working well. So again, all of these are all under the umbrella of arthritis, okay? And so there are a lot of different types of syndromes that are associated with this disease process. So let's play with this. You've got a thing right there, and we'll do it together so that no one's on the spot. But let's just go over. So A says usually has no symptoms until a painful bone fracture. Which one do you think that might be?
Osteoporosis.
Osteoporosis, exactly. So 5 and A are matched. Number B, a condition characterized by widespread muscle pain, joint tenderness, and pain when pressure is applied to a specific body part. That one is the fibromyalgia, okay, because there's a pinpoint pressure. C, a condition characterized by muscle pain and stiffness in the neck and shoulders and hips, and it may also result in fever or weakness or weight loss.
Rheumatoid arthritis.
Now that's the polymyalgia. Yeah, stiffness, and so it's really stiffness in the neck and shoulders and hips and pain. So C is actually polymyalgia, it's 8, polymyalgia rheumatica. Okay, number D, a condition in which the body's immune system damages the moisture-producing glands, mainly the salivary glands and tear ducts. Symptoms may include dry mouth and gritty eyes.
That's number 11.
That's number 11, it's the Sjogren's syndrome, yeah. Number E, autoimmune disease in which the immune system turns against parts of the body it is designed to protect, leading to inflammation and tissue damage. 7, that's lupus, yep. You guys know it. F, a chronic inflammatory disease that causes pain, swelling, stiffness, and sometimes deformity of the joints. That's rheumatoid, yeah. So remember, with rheumatoid, you end up with that deformity. And it's bilateral.
Yeah.
F is 2. No, yeah, F is 2. G, chronic inflammatory disease of the skeletal muscles, particularly those closest to the trunk, hips, thighs, shoulders, back, and arms. So that's polymytosis. Number 9. H, occurs in conjunction with the scaling skin disease of psoriasis. Symptoms can include scaly red patches of skin, joint pain, swelling, and stiffness.
Psoriatic arthritis?
That's number 10, psoriatic. Did I miss that when we talked about it? I may have. But essentially, that's what psoriatic arthritis is. Okay.
H is 10.
I, inflammation between the vertebra and the joints between the spine and pelvis. Symptoms may include back pain and stiffness.
6.
That's number 6, exactly, alkalizing spondylosis. J, pain and stiffness in affected joints, particularly after periods of rest or exercise, or when weight pressure is put on the joints. Joints may feel like they're rubbing together and can make a cracking sound. Osteoarthritis, exactly. And then the last one, K, when uric acid accumulates in the blood, it seeps out into tissues forming crystals. That's gout, number 3, yeah. Okay. Who treats arthritis? It's a multidisciplinary team because there are multidisciplinary needs, right? So you've got the rheumatologist, which is the main MD who specializes in rheumatological joints and muscles and spine and all of that stuff. And then you've got an orthopedic surgeon. So if any of the arthritic complications would need surgery, you would go to an orthopedic surgeon. So even before I was diagnosed with my polymyalgia rheumatica, all the pain that I was having, they sent me to a sports medicine guy because the clinic has this beautiful sports medicine department who was an orthopedic surgeon. And he, part of the reason also they diagnosed me is he gave me a steroid injection in my shoulder. And I had a systemic relief from it. So wasn't just my shoulder that it helped relieve, it helped relieve the pain in my hips too. So that was sort of a corroborating point for the diagnosis. So orthopedic surgeons can be very active with the rheumatologist as far as dealing with the symptoms and the side effects of arthritis.
Joanne,
Yeah.
excuse me.
Who's talking?
What did you say about the hips? What did you say about?
Well, with the polymyalgia, the pain was in my shoulders and my hips. So he gave me an injection in my shoulder to help with that shoulder pain, but it helped with my hips too. Because it ended up being what they say is a systemic reaction. It wasn't localized, it helped all over my body. And that corroborated the diagnosis because my whole body responded to the steroids. So a physiatrist essentially is an MD who has studied physical therapy. Okay, so we're familiar with the physical therapists who do our treatments and help us, but the physiatrist is actually a medical doctor, an MD, who specializes in that type of medicine. And then a podiatrist, we all know what a podiatrist is, but especially if you have gout or some problems with your feet, you're going to go see a podiatrist. Occupational therapists are important. Occupational therapists can help us with devices and things that will make our life more easy and manageable. And then we have the physical therapists who we're all familiar with, and it is so important as caregivers that we encourage our clients to do their physical therapy, right? So I had that pain on my back, I got x-rayed, they didn't see anything, they sent me to physical therapy. I am a nurse, I work with you guys, I know the importance of it, I got the regime, I did nothing. I'll do it in an hour. I'll do it in an hour, right? I needed you guys at home with me saying, Joanne, get off your bottom and do your PT exercises. But it makes a difference, and we've all seen it, especially even with our Parkinson's clients and our dementia clients and our stroke clients. Physical therapy makes a tremendous difference. And exercise is so important to maintain flexibility and strength and balance. And then we can also get a psychologist or a social worker involved. A psychologist can work with some of the emotional issues associated with the pain that our clients are feeling. Social workers can help with services that are out there that can be provided for them. So this whole team really works together to manage this disease. Now, we also gave you a handout on pain management, because pain is the #1 symptom of these processes, right? And we all know that we all react differently to pain. Some of us have a very high tolerance, some of us have a very low tolerance to pain. And we have to believe that if our clients are telling us they're in pain, they're in pain. And what may be hurting them may not hurt us, but it's irrelevant, right? We're dealing with the client where they are at that point in time, and so we're trying to work with them. So medications are used for the arthritis, and as I said, I mean, I think steroids are like the #1 go-to drug, right? I mean, they helped me within 72 hours. I was pain-free, and I hadn't been pain-free for 9 months. So it was dramatic. But they tackle the inflammation, which reduces the pain, but they have a lot of side effects. Okay, so I was lucky with the steroids. I didn't get diabetes. I didn't get a lot of the problems, but I had a really bad gastritis. Yeah.
I had a steroid shot, that stuff hurt. They told me broke my knee.
All the injections, yeah.
Yeah, he tried to hit my man like I was thinking about the thing, sprayed on my knees. And before I could think, he was one knee and the other one the same way, but didn't help.
Yeah.
You
Well,
know, to me it gets worse.
the shoulder pain hurt, but I was taking oral steroids.
Oh,
Okay,
okay.
so oral steroids over a long period of time. It's been 10 years and I'm still on 2 milligrams a day, which is nothing. But for me to wean off of the steroids completely, I have a relapse. Now, there are a lot of people that have polymyalgia that have a relapse. You know, they can be weaned off the steroids and that's fine, but there's a group of us that cannot be totally weaned. And 2 milligrams is less than what your body produces. But steroids have a ton of side effects. And then they also take the NSAIDs, like the ibuprofen and the other non-inflammatory medications, and they have their own side effects. You know, a lot of it is gastritis and things like that. So the medications, while they're very effective, can also cause other problems that we want to be aware of when we're working with our clients. Yeah. But there are other options than medications, or there's other things that we can do in conjunction with the medication. So the clients are gonna take whatever their rheumatologist recommends, they're gonna do their physical therapy, we're gonna help them with all of that. But we can also help them with things like hot and cold treatments, massage, meditation, acupuncture, and nutritional supplements. You know, and there's a lot of those alternative therapies out there that can be really effective. I mean, there's lidocaine patches now over the counter too. You can put those on areas that are in pain. And the hot and cold patches, they work too. Meditation is something the client really has to be willing to do. And when you're in a lot of pain, it's really hard to sit quietly, you know. But even maybe like music therapy, you know, and light therapy and things like that to make the environment more calming for them so they can try and just calm themselves down. I tried acupuncture before I was diagnosed. It was helpful, but it didn't last. You know, so I had to keep going back and getting the treatments. But a lot of that stuff works, and it works especially in conjunction.
I have a three-stage renal, so I can't take a lot of medications. So I do have to sit back and relax, you know, and it's a towel that the therapist gave me to put on my knee and lay on flat my back and put my knee far as I came to my chest. And that do relieves a lot of it. But you know, it lasts for a few minutes and it come right back to pain, but I can't take anything because of my kidney failure.
Right, which is the problem. Because a lot of the medications we take are cleared through the kidney. So if our kidneys aren't working properly, we're in a lot of trouble. And Tylenol is cleared through our liver. So if we have problems with our liver, or if we drink excessively and then take a lot of Tylenol, we can have problems with our liver if we didn't have it before. So we have to be aware of all that stuff. But there, but so there are other things out there that can work in conjunction with the medications, not necessarily in place of them. I know I was reading today too in one of my news feeds, they were talking about turmeric. So turmeric in the Ayurvedic world is an anti-inflammatory. And they studied it for a while in the past and then they stopped because the problem with turmeric is that the dosage that is in those, like the turmeric lattes and the over-the-counter turmeric and the Ayurvedic turmeric, isn't absorbed well. and it isn't enough to really give that anti-inflammatory effect. So they were also mentioning that some of those places provide turmeric and pepper, a combination. The pepper is supposed to help the body utilize the turmeric, but then the pepper can affect other medications that we take. So, you know, I mean, I believe, having that yogic background and that philosophy background, that Ayurvedic medicine works. But there hasn't been a lot of research over the years, especially in the West, on how effective it is and how to do it. But they are doing a lot of research now into turmeric because they also believe it can help with some cancers and other things. So they're restarting the research. Yeah.
Joanne?
What about ginger?
Ginger is great. I love it. I eat it like candy. It's good for your stomach, but it's not going to affect the arthritis. But it's great for your stomach.
On the turmeric, does it work better if you take it as a tea or in a capsule?
So what it's saying is that the dosage that we get in those capsules and in the tea is so small based on what we actually need for the anti-inflammatory effect. And what it's saying is that the body doesn't utilize it, metabolize it very well. That's what the article this morning said in my newsfeed.
So, I use turmeric. Every time I have a pain,
Mm-hmm.
before that time, I used to just drink it. I get the root of it,
Uh-huh.
and I just make it with the ginger
Mm-hmm.
and lemon. I put lemon
Yeah, yeah.
and what else? Something else. Another spice I put in there.
Part
And
of
by
it.
the time I wake up in the morning,
Cinnamon.
I don't have any pets.
Cinnamon.
Cinnamon.
Okay.
And cinnamon. And by the time I wake up in the morning, I don't have any pain.
That's great.
The people at my job said, Leonie, how come I never hear you complain for pain?
Well,
I said,
and-
because I
and-
don't have any.
And you know, the time I spent in India, they swear by turmeric and the ginger and the cinnamon and all of those things. And I think they do have an effect, but I think also too, it depends on how, maybe possibly, and I don't know for sure how severe the arthritis is at the time or what the pain is associated with. You know, if it's a gastrointestinal type of thing, everything you took is perfect for the stomach, right? So it depends. I guess it depends. Yeah, Donna.
I have a doctor who was a prominent internist for many years, and he takes turmeric in the capsules for pain management, also for anti-inflammatory.
Right, that's what it's for. But I took it before I got diagnosed, before I was on the steroids, and it wasn't enough to stop the progression of my disease. So I think it's on a case-by-case basis, and it's not gonna hurt you.
Can you take too much of it? I
No,
mean,
it's not gonna hurt you.
That's what I
It's not
wondered.
gonna
I
hurt
heard that if you take too much, that it can damage your liver.
you. That I don't know, but from what I read today, the doses that you're getting in the over-the-counter stuff that we have here in the States is not gonna be that much, because they're finding with the research that they need a higher dose to be more effective. So, yeah.
What about
Do you take it
curcumin? Is
put
that
on
like
food
a
or do you
generic
put it
or
in
what is
capsules?
that?
Curcumin is the active ingredient in the turmeric. Curcumin?
Yeah,
It's,
take that and say it's generic.
well, it is the active ingredient, so if you're taking curcumin, you're getting the active ingredient that is in the turmeric itself, in the root.
Saute.
Oh, I see.
And then I
So
just
it's the
put
same thing, it's just the active ingredient.
coconut juice and just clean my face. It's so
Okay,
virgin.
let's move on.
Nothing's better than that.
Okay, so as a caregiver, how do you assist your clients? I mean, and this is stuff you guys know, you encourage daily activity, you want to keep them active. You know, you don't use it, you lose it. You want to help prevent falls. And we know in general, the aging process, we're more at risk for falls because of the imbalance in our inner ears. We age because of our sight, because of our lack of mobility in general. So with these clients too, falls become a problem even more so because of the fractures that can happen, because of the joints and the bones. We want to prepare nutritious meals, and in a minute we'll talk about some of that. And we want to assist them with their daily activities. They may not be able to do the things that they used to do. We want to do what we can to help them to make it as easy as possible for them. But to encourage daily activity, we want to, let's see, yeah. We want the exercises to strengthen the muscles and support the muscles that support the joints, okay? So their range of motion is limited, there's pain in the joints. If we work those muscles around those joints, we're gonna support them more so that they're more comfortable. walking builds, it strengthens the bones, you know? I mean, again, just being a woman past menopause in your 60s or 70s, your doctor's gonna tell you to get out there and walk. It's the best exercise that you can do in the world. It helps build strong bones. It helps with weight loss and maintenance. I mean, if we end up, we're in a lot of pain, we have strain on our joints and we start to gain a lot of weight because we're inactive, it's only gonna put more strain on our joints, right? We want to improve and maintain our joint flexibility and strength again with the exercise, obviously improving balance. By strengthening, by walking, by maintaining our flexibility, all of that's going to improve our balance. And then it's also going to promote sleep, because if we sit around all day, we're in pain, we nap to run away from the pain, and then at night we don't sleep because we've been napping off and on all day. And again, even with all of our elderly clients that don't have arthritis, the more active they can be, the better off they're gonna be, right? But other things that you can do than walking, which is great for them, they can do aquatic exercises or swim. And a lot of places have the water aerobics for a lot of the elderly. And the water is great for the joints and the body because it keeps, you know, a balance around them so they're not really straining anything. Riding a stationary bike or using the elliptical machine, again, it's taking some of the pressure off of the joints, but they're getting that exercise. Gardening is a great exercise if they can get down on the ground. Some of our guys can't get down on the ground, so that's a problem. Or, right. Well, they'll get down, but they'll never get up, right? Dancing is a great exercise, right? I mean, put on some music and dance with them, get them moving. Yoga is a great exercise, but again, you know, it depends on, you want to be careful, making sure that you do a gentle, slow flow type of a yoga for them. And then Tai Chi is another exercise. It's really great for balance. And they actually were doing research with Tai Chi for Parkinson's and finding that it's very, very helpful. You know, because the Tai Chi is very slow, controlled movement and held positions. And that really helps with some of the balance problems that we have. Any questions so far, guys? Okay. So we want to prevent falls. Duh, right? I mean, we want to prevent falls in our clients anyway. But with the arthritis and the problems with the lower extremities, there's an increased risk of falls. And with the steroids, so they're on the steroids, it will weaken the bone. So because I've been on steroids so long, I have to take calcium, okay? And I do get those bone density exams every year, just to make sure that I'm maintaining my bone density so that I don't have fractures that I don't realize I'm going to have. And so corticosteroids are a problem with these clients, and bone thinning and falls and fractures. Let's see. And also we want to worry about fractures, like if they fall and they fracture their wrist because they use their hands maybe to block that fall. You know, small joints too might fracture more easily because of it. What can we do, right, to help reduce falls around the house? And again, this is preaching to the choir here. It's stuff that you do all the time with all of your clients, but just in general, maybe they have a railing on one side of the stairway. Maybe we need to get a railing on the other side so they can hold both sides as they go up and down the steps, right? We want to make sure that there's no clutter, right? We want to get rid of fur rugs. We want to get rid of cords. We want to make sure that they're using their walkers, they're using their canes, they're not being foolish and thinking, oh, I can do it, or I just need to go from here to there, and then all of a sudden they're down, right? We want to encourage them to wear shoes with non-slip soles. Maybe we need to get Velcro or get the shoes where they have the elastic laces so that they don't have to tie them because their fingers aren't working, and they can just slip their foot in. We want to make sure they're not walking in their stocking feet on wood. It is the slipperiest thing in the world. You want to make sure that if they're washing the floor, I had someone come in and wash my floors once, and she used Windex in the floor to make it shiny. I almost fell down my steps. I said, don't you ever, well, she wasn't with me very long, but don't you ever do that again. It was before, I said, wow, this floor is shiny. I've never been able to get it that shiny. It almost killed me. It was the Windex. So we want to see what they're using in products if they have a wood floor. We want to encourage them to, let's see, to have everything like waist level so that they don't have to reach high for the things that they use most often, so that it's easy for them to access it. And for some of our clients, you know, they've been doing the same thing for 70, 80 years, so it may be hard to get them to change. Well, we want to encourage them and tell them, look, it's for your safety, you know, it's not just for convenience. Again, make sure stairwells are well lit, make sure hallways are well lit, you know, so that they don't trip. Those motion detector things are fabulous for the clients. But all those things are gonna prevent falls for them. But again, this is stuff we do with all our clients all the time anyway, right? Okay, food. So some foods help fight inflammation and some of them may trigger an arthritic attack, okay? So the foods that help inflammation and help fight it are fruits and vegetables. And again, it's a basic healthy diet. Whole grains, fish, nuts and seeds, olive oil, beans, and fiber. And the things that are not good that we want to try to get them to avoid would be the saturated fats, the trans fats, salt, sodium, sugar, alcohol, and dairy products. The sugars and the salts, I mean, a lot of our clients have comorbidities that we said already. They may have hypertension, they may have diabetes in addition to this. So some of these things we watch anyway, but what's most important is to know what restrictions your client has, okay, because of the comorbidities or because of the allergies that they might have. So it's important for us to be aware of what they can and can't eat in general, and then encourage a healthy diet. Mm-hmm. I just did a blurb for the newsletter for Alzheimer's disease, because the American Alzheimer's Association has designated June as Alzheimer's Month and Brain Month. And again, they're finding with the research that a healthy diet and lifestyle affects cardiac, it affects our kidneys, it affects our lungs, it affects arthritis, it affects everything.
Can we use grapeseed oil? I like to cook with that.
Yeah, that's a good oil, grapeseed oil, yeah.
Grapeseed oil is good.
Yeah, grapeseed oil and avocado oil too is a good oil to work with too. Yeah, yeah. So meals are important, right? And what we eat is important. And again, this is a hard one because a lot of our clients are set in their ways, right? I mean, you know, like I talk to our new caregivers, choose your battles. My mom always said choose your battles. Well, some of our clients are not going to eat healthy, and it's almost impossible to get them to eat healthy because they've been eating the same way for 90 years. Right. But we do what we can. We try. Yeah.
But doesn't fruit have a lot of fructose in it?
It does. So if they're diabetic, fruit can be a problem. So we have to balance these comorbidities and what restrictions they're on. But citrus fruit and vitamin C can work as an anti-inflammatory. So maybe instead of giving them orange juice, you might want to give them like a piece of orange. So there's a little bit of roughage there too,
Yeah.
you know, to compensate for that. Okay, so assisting with daily activities, and again, this is stuff that we do all the time, right? We help our clients with bathing, we help them with getting dressed, we help them with transportation and meals, and we want to encourage them to do family events and to stay active and to be involved with the people that they love so that their mental health stays well. We want to encourage and maintain their activities and routines. But some of the things that we can do, so like their toothbrush, we can put like a foam wrapping around it so it's easier for them to hold, right? We can place a towel. Most of our clients have shower chairs or they have the over-the-tub chairs if they have a tub still in their house. But even so, you can place a towel on it so that it's easier for them to slide, you know, as opposed to trying to get in and out without that. We can put, instead of asking them to dry down or drying them down, just have them get like a big terry cloth robe that they can put on afterwards and just bundle up in it. It's going to dry them, but it's going to be easier to manipulate than a towel trying to dry your back or something. Shampoo dispensers, liquid soap dispensers instead of soap bars that fall out of your hands. But then also, the first thing that I loved about that Parkinson's orientation is they suggested that you take that bar of soap and you put it in a stocking, and you tie the stocking to the like a handrail or something in the tub. So if they drop the soap, all they have to do is grab the stocking and pull the soap back in their hand. Because a lot of people like bar soap as opposed to liquid soap. But I mean, for us, it's easy to bend down when we drop it, and I drop so all the time. But this way, if it's in the stocking, for me, it's still easy, thank goodness, yeah. This way, if it's in the stocking, they can grab it and pull it towards them, so that's another little trick. The other thing they're suggesting here is use Velcro for the buttons, but if it makes them uncomfortable to think they have to Velcro their shirts, sew the buttons on the outside where the buttonhole is, so that no one knows that there's no button there, right? That it's Velcro, and this way the image is still there of a button shirt, but it's Velcroed underneath. I think that's a great little thing. I like that as much as the stocking and the sew. And the other thing they're saying is if they're having problems getting in and out of a car, use a plastic bag. Again, that's going to get them to slide. So things that are going to make it easier for them to slide as opposed to having to move their legs and their hips. Okay? We're not going to do that. So assistive devices. Button assist tools. So these remind me of, I don't know, all of you, some of you are, but most of you are my age or older. Remember when we used to thread a needle? And we had that little thing that we could put through the needle so we could see it, so that we could pull it through a small needle. So the button assist tool is the same principle. You can put it through the hole in the button and then pull that button through the hole. Yeah.
I thought another thing that helps you get the thread through the hole is put a little hairspray on it.
Mm.
I mean, it makes it tight,
Stiff.
it makes it hard, and then you can get it right through.
It's just easy to hold.
Okay, automatic chair and seat lift. So those chairs that go from sit to stand, we can have maybe their family get one of those for them. Again, kitchen utensils with large grip, and we can modify everything that they hold with a large grip, so it's just more comfortable in their hand. Plates with curved sides so that the food tends to go towards that side, so it's easier for them to get it up. Raised toilet seat. I mean, the old toilet seats in some of our clients' homes are so low, you know, and they're horrible. And even without arthritis, as we get older, it's horrible to get up and down from those seats. And then extended reachers, they're also very helpful. And so, I'm just having a senior moment. The occupational therapist is a good person to get involved to help with some of these devices because they know where to purchase them, but you can get anything online now anyway. You know, just go Google it and the families can find it.
That design, that's nice.
Yeah. So always, guys, recognize, record, and report. We are with these clients all the time. We want to recognize what's going on with them. We want to watch the changes in them. Arthritis, like a lot of our clients' diseases, are progressive. The pain might get worse over time. The disability might get worse over time, especially with rheumatoid arthritis and the cramping and the deformity of the hands and stuff. So we want to recognize it. We want to observe how they're managing in their world and if there's anything else that we need to do to help them. Always report to the franchise. You know, that's your mantra. Call the office, call the office. And we want to document the changes and things that we're seeing in the journal so that anyone following us or anyone that's filling in for us can see what we've done to help, see the changes. The family, we know families read journals. We know families sometimes don't like what we write in journals, but we want to document this information because it's important for their care, for their plan of care, and it's important for you to tell your client care manager so that they can help you. You know, in modifying or talking to the families if they're not hearing you. Or the client who might be stubborn and not want to give up some kind of independence because they just don't want to, right? So any questions? No?
Say it again.
Any questions?
I don't have really a question, but I find that with a lot of clients, they don't have any patience, and they want things to happen like in
Right.
an instant.
Right.
So my one client is very bad at that, so I tell him one day, I said, well, don't get depressed, have a little patience. I said, even an egg can walk in enough time. And that made him smile, and he thought about that.
Yeah.
You know, an egg hatches, and then eventually
Right, and then
becomes a chicken and he
chicken
walks.
walk and then it'll fly.
You have to have
Right,
patience.
right. And so, I mean, the other thing we have to remember too, so our clients are older, they're losing their independence, they're in pain, right? Pain makes you cranky. It really, I mean, personally, I know it makes me cranky, right? And so sometimes their reactivity, especially if they're having a day with really bad pain, but they're not the type to whine about the pain, but they're really cranky, you may think that they're having a lot of pain that day and try to do something to mitigate their pain, you know. So, you know, I mean, a lot of times, you know, especially like with our Parkinson's clients, but even with our people that are verbal, I think that sometimes we can't really express the need that we have or the reason that we're having this reaction. And so for us as caregivers, we need to really intuit what's going on with our clients, get to know them so that we can read them better than they read themselves, so that we can help them. And I think that's a lot of what we're very, very good at, because we're caregivers. And we wouldn't be caregivers if we weren't very good at reading people and understanding their needs. We certainly would be doing it because we would be frustrated, right? So I think that's important. Okay, we have a quiz. We'll do it together, don't worry about it. But especially for those of you that are in the TULIP program, I'm gonna hand it out. And we'll do it together. No quiz anxiety. First question, what's your name? Yeah, well, not good, I don't know mine either. Mine's Hey Mom. And then today's date is the 23rd. 23rd? Yeah, 23rd, yeah. Okay. So number 3, the two most common forms of arthritis are actually C, osteoarthritis and rheumatoid arthritis, not osteoporosis, osteoarthritis. The answer is C.
That's true.
Yeah. And those are hard because it's both osteo. But osteoporosis is a little more of the thinning of the bones that we get as we age in general. Okay. The symptoms of rheumatoid arthritis include
All of the above.
all of the above. All of the above. One symptom of osteoarthritis is, that would be A. It would be the joints may feel that they're rubbing together and that cracking sound that you may hear. A rheumatologist is the only doctor in the healthcare profession where that was false. Yep. A caregiver can assist a client with arthritis by helping to prevent falls, encouraging daily activity, preparing nutritious meals, and assist with daily activities. All of the above. All of the above. Number 8, you believe the client could benefit from using an assistive device. What should you do? Call the franchise. That's your mantra. Patience and call the franchise. Arthritis is treated by a multidisciplinary team which includes a rheumatologist, a physical therapist, occupational therapist. All true. Yeah. Number 10, arthritis is treated with medication as well as other methods of pain relief such as all of the above. Number 11, it is important to encourage daily activity to increase, to increase muscle strength, endurance, and balance. It's true. And then number 12, fall prevention is especially important for people with arthritis because long-term use of corticosteroids leads to thinning of the bones and an increased risk of fractures. True. So make sure your names are on them, guys. Put them in the center, and I'll collect them. And unless you have any other questions, that's all I have to offer right now. I hope it was useful to you. Any other questions?
No, thank you, it was excellent.
Okay, good.
Very good.
Good, thank you. I'm glad you.